Okay guys, now this is a review video I've been looking forward to doing for ages because it literally makes me so happy. So this was having laser eye surgery, LASIK surgery with Optimax. Now I've taken some notes about this one because there's quite a lot of detail to go through. There's not so much of a product to show you, it's a service and to talk to you about the results. So I've got some screenshots of documents that I'd like you to see. You'll see them in person anyway if you decide to have laser eye surgery with them. But also they're offering, as part of my video here, they're offering an additional £300 discount if you decide to go ahead with laser eye surgery after seeing my video or a little bit of encouragement from myself. So you'll see the link in the description. This is nothing to do with me, I'm not getting any sponsorship at all. They did actually give me £300 discount when I went to have laser eye surgery because my local branch wasn't available. So they're quite friendly like that, they do their best to help people out financially. So basically, to get it started then, my experience was terrific, absolutely love it, best decision I've made in my life. I don't regret it at all. But I need to say from the start that because it's like a cosmetic surgery or private surgery and enhancement, everyone's experience of course will be different. I'm just so glad mine was a fantastic one. But if I'm hoping by the end of this video to help some people get the courage to go ahead with it, because that was my problem. I know I wanted to do it, but I'm terrified of anything to do with eyes. I first realised that I needed to wear glasses when I was 18 and I was learning to drive. Unfortunately my parents weren't the sort that would take us to these places. We got braces through the dentist and things like that, but I can't recall ever going for an eye test with any of my parents. So when I started learning to drive and I couldn't see a number plate from the 20-metre distance, we kept getting closer and closer in the car, and the driving instructor said to me, "You need to go and get your eyes tested." When I did, that's when I realised that I was short-sighted, and not just slightly, quite a lot. So I started wearing glasses that I bought from Specsavers. I found it really difficult to pick glasses that suited me. I did not like it at all. I found them a bit of a hindrance. You know, if you went to the cinema with friends and you watched 3D movies, you then had to put 3D glasses over your prescription glasses just to see what was going on. When it rains and the steaming up and the smearing, when you're trying to exercise or jog, they're just sweaty, they can fall off your face, and it's just horrible. There's always a geekiness about them as well, like a stigma, and I didn't like that. So a lot of it is vanity, and I can't even imagine getting older and looking back on my life and seeing pictures of myself in glasses at different events and thinking that's not how I want to remember myself. So vanity played a big part, but I also had issues with the glasses as well. So like Specsavers, I'd buy them from there and I'd find like the nose bits would always come off, or the arms, the hinges would come loose after a while, and they lose that springiness, and they're not made to last. The only bit of advice I've got for anybody who has glasses is that what I would do is get my prescription updated. I would go to a website called Glasses Direct, and I'd place orders through them where they actually make your glasses up with your prescription. With some voucher codes you can actually get them very cheap, and because my prescription was being changed every 2 years because of being a driver, and naturally my prescription just seemed to get worse for a period up to about 25, I actually found that it was just easier to buy cheaper glasses rather than going down the line of buying expensive designer glasses that only last a couple of years. It just seems a waste of money. So that's what I decided to do. What I'm going to do, I think, is I'll attach some pictures to this video of the distances that I could actually see at my worst. So you can see pretty much the range of vision I had before I had laser eye surgery, and I'll try and do a picture of the distance that I can see now that I've had the procedure done. Big issue for me was phobia of eyes. I'm absolutely terrified of anything to do with touching eyes, anything in a film that's like a violent scene that involves eyes being injured. I couldn't look at it, I would feel sick, I'd start to sweat, I'd have to get up and leave the room. I just can't watch those kind of things, they really freak me out, and I can recall films off the top of my head that have those scenes in them. There's a few that actually feature laser eye surgery in films, and I would advise you not to look at those because they don't help if you're trying to mentally prepare to have this procedure done. And besides, actually the procedure is nothing like what the films project it like anyway. So yeah, don't look at that, it doesn't help. You don't need to worry about what the surgery looks like because that's the surgeon's point of view. All you need to worry about is what you will see, which I'll explain as I go through my day of surgery a bit later on. But it's basically nothing actually in the grand scheme of things. You don't see much at all. So when I was building up the courage to have the surgery carried out, I was about 26, and it took a couple of years. I didn't have the surgery until I was 29, so last year. I watched quite a lot of YouTube videos, other people telling me how their experiences had gone with Optimax and with other treaters, I suppose. And it's so difficult. You can be watching this video, and I've had it done. I'm trying to tell you how easy it is, but being the viewer, it's very difficult to believe what they're saying when you're so phobic of eyes. But all I can say is afterwards you will look back and think, why did I make such a mountain out of it? It was so easy. It really does surprise you how easy it is and how quick it was as well. So if I can do it, I strongly believe anybody out there watching this can do it. Just take the time to build up to it. So I started, for example, with eye drops training. So I couldn't do anything to do with touching eyes. I couldn't even do eye drops. So I got some ones like from Optimax, and I started just on closed eyes, just dropping them into the corner and gradually opening my eyes and letting them roll in. Little things like that. It took about 4 months. So carry on doing that. I couldn't stand looking at the pictures of eye drops where you see a doctor go like this, pull the eyelid down and drop in. It just that would freak me out. So it's just gradually building it up. Do it slowly and kind of teach yourself that there's actually no danger in doing it. There's no reason to be scared in doing this. It's really easy, it's really simple, and you'll find that you just build confidence up and up and up until eventually you're actually doing an eye drop yourself and you don't even think about it. In fact, don't look at the thing that you're doing, just look at the ceiling directly above you. Don't even look at it, and it happens. It'll just come to you one day. So that was how I gradually came over that phobia. I also, in a background note, had some training to deal with a pain condition that I've got, which I can tell you about in another video if it helps. But I was seeing somebody who was basically teaching me to understand how to control pain from the mental side of things, because there's nothing physically wrong with me, but I have got a nervous system pain-based complaint that can flare up now and then. There's no treatments for it. I went through the NHS and it was a nightmare trying to get any help or anyone to understand, but I found someone who treated me privately, and it was actually more to do with the power of the mind and thinking about things, and that's what gave me the go-ahead to do laser eye surgery, because the techniques he taught me weren't just to control the pain I was feeling, but also to change the way I think about certain things. And by changing the way I think about eyes and the threat of eyes and things like that, I gradually got the courage that's built up in me, as well as doing the eye drops, to be able to say, yeah, I'm definitely going to do this treatment, I'm going to have it done. I suppose another thing to do is to stop calling it surgery, because it's not surgery, it's a treatment. It's something you're choosing to do to improve your life. So the best way to refer to it is just an eye treatment. So that's what I'll try and do for the rest of this video if I can remember, but it's not the politically correct term for it. So after I decided to go ahead with it, I started looking around to try and decide who should be the best provider. And what tipped me towards going to Optimax was the fact that their surgery, I've done it again, their treatment is basically the top of the range one that you can get. So whereas other providers offer you the treatment and you can have it done this way or that way, and you can pay extra for wave technology and all these different technologies to make your results better, Optimax do it all in one package, so there's no levelling up, which is great actually. It makes it easier to work out costs and easier to decide to go with it. It's really good to know that they are pretty much all over the UK as well when it comes to booking appointments. I believe there's 20 different locations, as at the time that I had the surgery. Now for me, I preferred to go to Hove branch, which is where I had the consultation. Hove is about 20 minutes drive from me. Really nice little branch in the middle of the high street. Sadly though, that branch became unavailable for me to have the treatment done at because they were closed for redecoration. Now Optimax were really compassionate towards that, and they offered me £300 off of my surgery if I wanted to go to Southampton branch instead, which is about an hour trip one way for me. I knew that if I sat back too long that I would probably chicken out a little bit of the surgery and lose the confidence that I had just built up. So I decided instead that I would go and eventually have it done at Southampton. But the first thing was to have the consultation, which I'll talk about a little bit more in a minute. So in terms of costs, the website does say that the cost per eye for wavefront LASIK, remember you've got LASIK and LASIK, two different procedures, but the price is the same for the wavefront technology. and that's £1,995 per eye. This is back of last August when I had the surgery. I chose to have that and spread the finance cost over a few years. Now I've got a good credit score, I've got things like a phone contract and a car on finance, so I knew I would be accepted. That was really easy. I currently pay back about £76 a month. That's really comfortable for me. You know, can you put a price on getting perfect vision back? I mean, that's really cheap, I think, personally. Obviously not, you know, don't have to pay it off in one lump sum is really good, really handy. So can everybody get laser eye surgery? Well, it depends. I believe there is an age limit, and there's probably a more ideal time in your life to have it done. I was always told after 25, because up to the age of 25 your prescriptions fluctuate. Given the procedure changes the shape of your eye to match your prescription, you don't really want it fluctuating too much, because then if you do it too early in your life, the procedure might be a little bit of a waste of time for you. So after building up the courage, I did it at 29. So prescriptions, my prescription was quite bad. It wasn't great, but as you can see on their website here, there's a prescription table telling you what they can and can't treat, but they also can treat people with astigmatisms as well. So the consultant will be able to go through that in much more detail with you once you book your free consultation. The only thing about the consultation is they do take a deposit. I think mine was £10. That's just to make sure people turn up to the appointment. It's completely refundable after. But in this day and age of people not turning up, just even to doctor's appointments, for example, you know, there's got to be something to incentivise people actually doing so. There you go. There's another little bit on their website now about the satisfaction that patients can expect. And here is another part of their website to do with the Aftercare programme. I'll talk more about that later on with my Aftercare programme. Here is their reviews on Trustpilot, which, as you can see, look, it's fantastic. You know, look at how many 1 stars and 2 stars there are. I mean, tiny percentages. Most people 5 stars. I even reviewed them 5 stars myself. Couldn't get better than they already have, really. It was just it was brilliant. Better than buying a sports car, in my opinion, and a sports car kept breaking down. So, you know, this has been the best thing ever, and I certainly rant and rave about it to people who are considering it. So, moving on to the day of the consultation, I booked this in for July the 9th, 2021, and I saw, I believe it was a Dr. Manish Ramid, hope I'm saying that correctly, with the £10 deposit. First thing that I needed to do when I arrived was, well, first of all, make sure you've got someone who can drive you there, because you will need to do some eye drops that will dilate your pupils, which means that too much light will get in and you won't be able to see really to drive safely. That was really easy. Colleagues at work were happy to pick me up and drop me off, so that went really well. I was taken downstairs, and first of all you have to use various machines and complete a questionnaire. The questionnaire is just a medical questionnaire, really straightforward on a computer. Now, bearing in mind this was during the pandemic, so there were certain rules about mask wearing and distancing, and that might be different now. The machines are really nothing to be scared of. One of them is just spirals, another one is the wind machine, the air machine that gives you a little puff. Now, a lot of people make a big deal out of this, and being that I had an eye phobia and I'd never had this eye pressure check machine done before, I was a little bit nervous and didn't know what to expect. But it literally is just a little sound. You don't even feel it. Your eyes are open the time, and that's it. It's really easy. Here I'm going to show you a table with the projected results from the consultation. This is based on all their previous subjects who've had the treatment carried out and what their results were. There is also a pie chart here as well, showing for my prescription at the time what are the likely outcomes based on all the previous treatments carried out. And as you can see, satisfaction of patients 99.63. I mean, that's incredibly high. I don't think there's much that you can really fault that about. Now, this was all given to me, this information, at the consultation. I had to do a little declaration to agree to the dilating eye drops, as you'll see here from this screenshot here of my letter at the appointment. So when I went upstairs after having all the machine tests done, which took all of about half an hour or so with the waiting time, and the receptionist staff are brilliant as well. They keep you talking in between. They know you're perhaps a bit anxious, and they really do help to keep you calm and just get you from one place in surgery to the next blade. So when I did get to sit down with the consultant, he did have to put a few drops in, and there's this little machine in front of you with the lights that shine at your eyes. You have to put your chin on the little device and just look ahead. The first one was to check for dry eye, and under the table my hands are doing this because I don't like having eye drops. And he literally comes towards me, he does this little boop, and it was done. Didn't even feel it, straight in. And this is to test whether I would get dry eye after the surgery, because apparently if you do suffer with dry eye before having the surgery, there is a chance you could get it permanently after surgery. It's a very, very low risk, but they do test for it. The second eye drop is more annoying than anything. It's the one that dilates your eyes so that he can use his devices to see right to the back of the eye. Now this one's like opening up a packet of salt vinegar crisps and a tiny drop of it hitting your eye, and you sort of go like that. So for about 10-20 seconds your eye stings a little bit, and all he said to me was keep your eyes closed, it'll be gone in 20 seconds. And that's what you do, you keep your eyes closed. And when I opened my eyes, incredibly watery, crying almost, he's there with a box of tissues, because you will need to dry your eyes. This is just part of the procedure. It's quite laughable. He explains that you end up looking like a Disney character because your pupils just go massive, but that's the idea of the eye drop, so it all works fine. What was really interesting at the consultation, and I'll come back to this later in the video as well, is he looked at all the information that the machines and the tests had provided, and he said to me, I believe we will be looking at getting your vision, your prescription, better than 2020, about 2 lines below the 2020 line on your classic eye test letter graph. I don't know I can't think of the scientific name for it, but that's it, basically 2 lines better than 2020, and that's what stuck in my head. So I went home with the information on the costs and on everything that happened. I'd had the deposit refunded to me for the consultation, and then it was just a case of me deciding when I wanted to go ahead, and it only took me 4 days to make up my mind, and I went, yep, this is what I want to do, I can afford it, let's go for it. So the very next thing that happened was I got a video consultation, bearing in mind at the surgery I signed a video consultation consent form, if you like. So my surgeon, I hope I'm pronouncing his name right, was Dr. Ghassan Ayobi. Looking, well, straight away, the instinct in me had me looking at all the surgeons on their website, and he seems to be the most senior, the most amount of years, 35 years at this, 39,000 treatments, 99% satisfaction rates and 97 success rates. How many people he's treated in the last 12 months is on there, the types of surgeries he's done. When I compared him to all the other people on there, including other young surgeons, no disrespect to them, but he was just the most experienced one, so I couldn't be more happier that that's who I'd been assigned. And he gave me a WhatsApp call about 2 weeks later, which I expected to be like 15 minutes long chat about the surgery and what was going to happen, but it was like 60 seconds, and he literally said to me, my name, address, date of birth, the date of the surgery, which had been planned at this point for the 14th of August, 2 days, just 2 days before I turned 29. I think that was the plan. I wanted it to all fall in place for my 29th. And I expected it to be a long chat. It wasn't. It was just 60 seconds. He was so confident that everything would be fine. He was like, don't worry, sir, it's all going to be fantastic. You're a very nice man. It's all going to go well. He's so polite. It was amazing. So that was kind of the consultation and the surgeon's consultant appointment as well, all done in one go. So that was a WhatsApp 60-second call. Now, knowing that I was a little bit nervous for the procedure, I went to my doctors and said, is there anything you can give me? I'm going in for this surgery. Is there anything I can take on the day just to make me a little bit more relaxed and calm? And they gave me 4 lorazepam pills. Now, obviously, being a worker, you've got to pay that. It's £9 something odd or whatever it was at the time for these 4 pills. I didn't test them out beforehand, stupidly. But my advice to anybody who wants some kind of extra calming effect and wants to go to their doctor and get some kind of drug that can help with that, I would ask for something stronger than lorazepam, because half hour before the surgery, when I decided to put it in, so I decided to take the pill, it did nothing for me. It was absolutely useless, so I wouldn't use that one. Go for better than lorazepam. Make sure you ask them as well. So my surgery went ahead for the 14th of August, and once again you have to take someone with you, someone who can drive you there and back, because you won't be in a condition to drive, and that includes 24 hours on your first checkup the next day. So there are some items I suggest you take with you. Definitely take lots of water to keep drinking, take any calming sedatives that you've got, take some eye drops if you want. I would say take some sunglasses, because your eyes will be quite sensitive to bright lights for the first, well, it's actually the first couple of weeks, not just the day of the surgery, but particularly the day of the surgery. I remember turning up at Southampton. My family left me there, and I sat in the waiting room. Now we were in groups of 4, just not to rush it and build up any pressure. The tests that we've done on the machines were repeated, because they do like to make sure that it is bang on and accurate. After those were done, we were sitting in the reception talking to the receptionist, all 4 of us. Of course, as you can imagine, 4 strangers, we were all a little bit anxious and doing our own things to try and get ready. We were all then given a number and told that was going to be the order that we were going to go in and have the procedure. So I was number 2. First gentleman went in, and then came my turn, and you go into sort of a separation room where you're prepped, so you have a little blue hat put on, some little shoe covers and an apron, mainly because the treatment room itself is sterile. It's completely clean. You don't want to contaminate the air or anything like that. It's got to be kept as clean as possible, and of course actually they advise you not to wear any synthetics or wool clothing and things. You don't want dust and debris flying in the air, not that it's likely to actually cause any trouble. So the nurses are very, very kind. They don't rush you, they just slowly take you into the treatment room, and there's a couch there. A treatment bed, I should say, probably. You just climb onto that and get yourself comfortable. There's all cushions put underneath your knees and behind your head and things like that. There's nothing holding your head like solidly in place, so if you're claustrophobic as well, nothing like that happens. You're quite comfortable. And obviously the doctor's there and all his nurses, and you can sort of look up at the ceiling, and there's the machine, but I didn't really take all that in, to be honest. He just introduced himself and his team and what he was going to do. The first thing is your eyes are closed, and they just use some antiseptic wipes to sort of clean around the area. And then I remember looking up, and he said, right, we're going to put some anaesthetic drops in your eyes now. And I just looked up, and because I'd got used to the eye drops at this point, you just kind of let him do his job. And it felt no more than a minute later, he said, right, all good to go. And the worst bit, the scariest bit for me was always the eyelid holders, because if you've looked, you probably have, if you're looking at doing our laser eye surgery, you've probably looked at the pictures of the eyelid holders at this point. Now, I wouldn't recommend looking at pictures of them because it doesn't help, but when you're sitting there, it's such an alien feeling. I can't explain it, and I can't really put it into words that do it justice, because there's nothing in life that feels like what they felt like. The closest is really just someone just holding your eyelids open as far as possible, and the eye that isn't going to be worked on at the time is taped closed, so you've only got the one open. It doesn't hurt because your eyes are numb, you don't feel any pain at all. It's just so surreal, and you blink because naturally you want to blink even when your eyes are being held open, but you do blink, but they do this little sort of quiver, so they don't close but they quiver, and the quiver is enough to satisfy your urge to blink. So it's not uncomfortable, it's not painful, it's not freaky or anything. It's just kind of, I don't know, unpredictably weird. That's the only way I can explain it. I remember there being some sort of a cone type device that was just put on top of the eye, and he just keeps telling you to look ahead. That's all he keeps saying to me, just look ahead, and just to stay still at certain points of the surgery, and all you really see is white light. That's all you see. Now obviously at different points of the surgery, if you know what the procedure is about, the flap being made and moved out the way so that the laser can then shape the inside of the eye, and then the flap's put over. You know, that's all the science behind it, but as a patient, don't worry about any of that. Just, you're looking at lights. One minute it will be white, then you'll see like red and green, and then it sort of, I don't know, it darkens, you get moved over, and there's like another machine. It felt like there was another machine at one point, one here, and then one came here. And when the second one came over, it went dark, it went sort of black. But it's nothing to worry about, it's nothing to be concerned about, it's just the procedure taking its course. I would imagine it's the shape of the eye, the way it's being changed, the light isn't perhaps getting back to the back of the eye so that you can see at these points. And he was very calming the whole way through. He's just saying, just hold position for 10 seconds, sir, and stuff like this. Really, really reassuring. Some people talk about the burning machine smell that's in the air. I didn't smell that at all. I didn't smell anything like that. Sometimes it can be a burning smell, but I didn't get that at all. Now, I think probably because the adrenaline was rushing so much in me, I probably didn't take in much detail of everything that was going on, because I did, towards the second eye being done, I did start to kind of a little bit panicky. I think it was just panicky at what was going on. I think my head was probably just racing too far ahead of me, of what was going on. So it wasn't fear, and I wasn't in danger, I wasn't hurting. I was just, I think the adrenaline had overcompensated what was going on, and I started to have like a mini, you know, when you have a little shock and your arms and your legs, your extremities go a little bit numb and tingly, that's what started to happen to me. So it was like a mini sort of, it wasn't a panic attack, but a mini blood sugar drop, I suppose, something like that. And that happened towards the end of the second eye being done. But I do remember when the eye clamps were out, just literally closing my eyes and holding them closed, and I said to them, you know, they said to me, it's all done now, you can get off and we can get off the couch, go to the waiting room. And I remember saying, can I just sit here for a little bit, because I've gone a little bit tingly and numb. And the nurse went down to the bottom of the couch and she grabbed my legs and she started making me cycle in the air. She said, this is just to get the blood flowing again. She said, you're probably just, low blood sugar, a little bit of shock from what you've gone through, but you're fine. She said, you're absolutely fine. So I sat there for a couple more minutes, got up, and they said immediately you can actually open your eyes. And although the fact that they're very watery, you know, it was like an immediate fix. It was crazy. So I went into the darkened recovery room. You do get some eye patches and eye guards and things like that to take with you, but I had my sunglasses on as well, and I had a little drink and something to eat. Just sat there waiting, and then about 5-10 minutes later, I went back into one of the optician's rooms where he just did some final checks with all the machine. When I say the machines, I'm talking about the one with the light where he gets to look at the back of the eye. He gives you a pack of various eye drops, antiseptic ones, and just eye cleaner type ones, just normal pure liquid ones, which are really, really nice, really lovely. Sadly, they won't post them to people. You can only collect them from the branch, which is a shame, because I started buying them. They're only like £2.50 for a box, and I think it's 30 or something like that. But they did give me a name of another brand of eye drop that you can actually buy that's just like theirs. So as I was saying, when I did the training with the Optimax eye drops, Optimax give you a slight sting when you put them in the eye, and the receptionist there told me it's because people who make these kind of eye drops put preservatives in them, and that gives your eyes a little bit of a stinging effect. If you buy preservative-free eye drops, that won't happen. So they gave me, I think it's called Clinitas Soothe, which come as a drop like this, or you can get them as the individual little vials, if you like. I'll just open one here so I can show you. Very easy to transport around, but they're just so lovely. I mean, if you've had a really hard day at work and your eyes, that breaks off obviously, and the lid breaks off and you just drop it away. If you've had a hard day at work, you've been working with computers, or just generally tired eyes, just to put an eye drop in is so lovely. It's so relaxing, I can't explain it. So that was my day of surgery / treatment. I'll upload a picture in a second of what I looked like the first night, but the advice is when you get home, just go to bed, just sleep for a few hours or have an early night. My surgery was later in the afternoon, so I could come back and just basically snooze. They give you some plastic eye guards to wear at night. Obviously you don't want to knock your face around for the first few days or so. I actually wore them, I think, for the first week, just to be on the safe side. 24 hours later, I went for the first checkup. My family dropped me down there, and he said, yep, all healing lovely, no issues at all. And then I believe it's 2 weeks later you go for your next one, and then a month later, and then 3 months later. Now, I still kept on going back to Southampton because the Hove branch wasn't open. They do give you loads of information in your aftercare package. I'm going to upload some screenshots of that right now to show you about the drops and what you need to follow. They also give you a GP letter here to explain to your GP you've had the surgery done, just so that they know it can go on your file. So when I went back for my final checkup after 3 months, I ended up seeing the guy who I saw at the very first appointment, which was kind of, you know, it's all come full circle. He did the normal reading tests, you know, the lines of letters and things like that, and he said to me, it's great. He said, you know, you're completely discharged now. He said your vision is that of a fighter pilot, and I was like, wow, that's brilliant. He said, and guess what? You have achieved 2 lines below 2020. which is exactly what the consultant said we would achieve in my first appointment with them, which just made me smile so much. It was so good to know that this had gone completely to plan. It's fantastic. I mean, what more can you ask for? So to be discharged, I said, I can obviously come back if I get any issues or anything like that, but I've never been back since. I'm now out and about enjoying life, jogging and cycling or whatever else it is. It's even long range at work. I can see things across the courtyard now. I can see things on the boards in the office that other people can't see. I can stand behind my manager in the office and I can see what he's typing on his computer screen. And when he's looking for a particular piece of information, I'm like, no, it's just over there on your screen, an Excel spreadsheet. Oh no, it's just on B2. That's how sharp it was to me. It's been fantastic, and it still is a year on. So I'm looking forward to really enjoying life with having really good vision again. I know they can't cure long-sightedness, so we're talking about reading, because that's a different part of the eye that ages as you get older. So they did say, probably in your 40s, 50s, you might need reading glasses. So that's a universal thing we're all going to have to deal with as we all age. But I think having reading glasses is a bit more acceptable to me. To be able to get glasses out to go, let me just read this. I feel more intelligent for that than I've got to wear glasses every day just to see where I'm driving, where I'm walking, where I'm running. I can't be bothered. I couldn't be bothered with all that, and that's what further encouraged me to have the procedure done in the first place. So what I'm also going to do is upload some prescriptions of before I had the surgery and after. Again, those images of the distance I could see before and after the surgery. It's still the best decision I've made in my life. The only thing I noticed, and this is actually improved and completely stopped now, and it's in the information packs, is that for the first 6 months after your surgery, you probably will see halo rings around lights, so street lights, car headlights, or you'll get that burst effect of stars. About 6 months in, mine started to disappear, and it's pretty much all gone now, which is really good. They do say, as a slight down effect of laser eye surgeries, can be that your vision at night gets a little bit worse than what it was before the surgery. Now, when I go out jogging at night, I have got lights on and things like that, but yeah, that is true. My long-range vision perhaps isn't quite as long as it would be with perfect vision at night of a normal person who's had no surgery. But having said that, I don't go out much at night, so it's not a worry to me. I would rather have perfect daytime vision and not worry too much about the nighttime being, a little bit less. And when I say a little bit less, it is a little bit less. It's not massively noticeable. It's not something to panic about. So, yeah, I hope this video has kind of encouraged anybody else to think seriously about having the procedure done. They're very nice people. I've got a lot of respect for them. I've got a lot of trust in them. I'm very grateful to the doctor who treated me and to Optimax. I'm so glad I did it. If I could go back in time and meet a younger version of me, I would say to him, you should have done this even sooner. Perhaps, I don't know, 3 or 4 years sooner would have been nice. I'm looking forward to enjoying the rest of my life with this really good vision that I have got, and it kind of opens up your mind to looking after your vision as well. It's probably one of the best senses we've got. You don't really want to lose the ability to see things clearly, so yeah, I hope this helps. Also look at the voucher code and the link in the email that I've put down below if you want £300 off. I'm going to talk to them about this video and the recipients and let them know they might continue the voucher code on. In the meantime, if you can like, share and subscribe, that'd be brilliant. Thanks.